Right, good afternoon, everybody. Hope you had a chilly weekend, but a relaxing weekend. Here with Paul and Josh and Selah Mascara-Bruno. She's our Commissioner of Housing. Good news to announce a little bit later as regards our rent relief program. We get that rolled out starting today. First of all, the last 3 days, the COVID summary. I think it's relatively good news that not much has changed. Remember, these are 3-day numbers, so you can divide by 3. Positivity rate relatively stable, as are hospitalizations, sadly, and fatalities. I do look around. I see that it's spiked up just a little bit in New York. That's up to about 4.6%. And then sometimes you look around the world to get an idea of what else may be happening. You probably have seen Europe has gotten hit pretty hard. Poor old Italy is closing down again. A little different than our situation in that Italy only has about 3% of their people fully vaccinated, maybe 6% have their first shot. Very different than the United States, which is at about 21%. So they are in a different situation. Israel, on the other hand, has well over 50% of their people vaccinated and moving back very quickly to a normal cautiously normal lifestyle, which is something that we can all hope for. Vaccinations are key, which takes us to the next slide. And you can see a fair amount has happened. We now have almost 60% of our folks 55 and above have received their first dose. 77% of the people 75 and above. A little interesting, you do get a law of diminishing returns. That's only up, I think, a percentage point since last time. 71% of the folks 65 to 74, that's up a few points, but slowing as well. 55 to 64, that's up from what, 32% just a few days ago. So that's still a pretty good activity there in that age group. And we think you'll see a significant uptick there, over 50% by the end of this week. Overall, about 31% of all of our adults 16 above, that's the only group, where we have vaccines that have been approved for people, have gotten their first dose, which is important. So because the rollout is going along pretty well, because the supply, we do have a 3-week window from the Biden administration, is strong and stronger than maybe we had anticipated even just a couple weeks ago, we're going to be able to accelerate our schedule just a bit. So what we had planned was to move into the group 45 to 54 on March 22nd. As you probably know, this Friday, March 19th, we're moving towards 100% occupancy in, retail and houses of worship and restaurants. So we think that March 19th is going to be the day we open up. 45 to 54-year-old, there's about 130 more thousand appointments that are opening up right now this week. So, please step in and use this opportunity. I think perhaps of more import is that the group 35 to 44, which we're planning to open up on April 12th, is now going to open up a week earlier, April 5th. And frankly, we're going to open it up to everybody eligible, 16 and above, on that same date, April 5th. So that is a shift. There won't be any more grading by age after April 5th, which is about 3 weeks away. A couple of reasons for that. The 45 to 54-year-old age group is a smaller cohort, so we'll be able to get through that a little bit faster than we had anticipated before. And everybody in these age groups, maybe 20% of them have already been vaccinated. We vaccinated all of our healthcare workers. As you know, we vaccinated, most of our educators, and the rest will be vaccinated, certainly by the end of this month. So that takes some of the load off. We've also seen that younger people may be a little less in a rush to get the vaccine. Don't take your foot off the accelerator. I want you to get vaccinated. We need everybody. But right now, there may be not quite the same demand as there were for, the 65-year-olds who are really, rushing the gate when their opportunity came up. And finally, it's worth noting, our supply of vaccine is going up. We've got that 3-week window. If we have 130,000 plus doses this week, it'll be about 40,000 more next week, and probably close to 200,000 the week of April 5th. So I think you can see that's a good 50% increase over the course of the next few weeks. That allows us to be a little bit more aggressive. And I want you to know one other thing, that there are, as of April 5th, there's no more change by age. Everybody is eligible, 16 and above. And that means our hospitals are going to be thinking very thoughtfully about folks that have, maybe some pre-existing conditions, IDD population. We're going to make a big effort to make sure that those folks who are, most at risk move to the front of the line. And I just want to say in general, as you see, we're opening up on March 19th and then April 5th. Again, there'll be a bit of a rush. So if you're relatively healthy, you maybe don't have to go to work every day, you can telecommute. If perhaps you think you've had some sort of a mild infection in the past, maybe don't, sign up that very first few days. Give those who maybe have a little more need up front a little earlier. We are going to have plenty of vaccines over the course of the next, month. I think you're going to find everybody has vaccines and appointments available to them. Next chart will tell you a little bit about what our thinking is, why we're keeping with the 45 to 54-year-old age group. This was a University of California study. I think it's interesting. The age-based COVID vaccine rollouts could save 85% more lives. That was compared to just a random lottery system of everybody over 16. So I think it does make sense to at least prioritize the next age group for another 2 weeks. And finally, I think this chart understands what that last headline was about and what our thinking is about. We're going to have, say, 2/3 of the people 55 and above vaccinated over the next, 4 days. And that's where 96% of the fatalities have happened over the last year, and it's been a year. 96%, and fatalities are sort of a proxy for hospitalizations and demand upon our healthcare system. Only 4% were related to folks 16 to 54. And then if you look at the next chart there, in purple you see the group of 45 to 54, which we're prioritizing for the next 2 weeks. While it's not nearly in the same category as the folks older, they're still 14 times more likely to suffer complications and fatalities than the youngest age group. So we thought it made sense to prioritize this smaller cohort, at least for those 2 weeks. And then from there, 35 and below, everybody's going to be available, and we'll be able to make sure that those most in need are prioritized going forward. There'll be plenty of questions on that, and Josh and Paul can help answer. But first, I really wanted to introduce Selah to you. As you know, this has taken an economic hit as well as a healthcare hit for a lot of our communities. We are blessed as a state to have a lot fewer folks rent arrears than most other states, but there's still a fair number of people who are unemployed, a fair number of people that haven't been able to get back to work, a fair number of people who have had a hard time making their rent payments and making their utility electric payments. And Selah is taking the lead as we roll out a relief program funded by the federal government. Selah?
Can you hear me now?
Yes.
Thank you, Governor. And yes, today is an exciting day for Connecticut. United City opened its door. It's a soft opening. Nevertheless, it's an opening. So United City stands for Emergency Rental Assistance for Connecticut's economy. The goal of United City is to help stabilize Connecticut's rental housing market. This $235 million program will provide rental and utility payment assistance to qualified Connecticut households financially impacted by the COVID-19 pandemic. The program will financially support households up to 80% of the head area median income. Eligible households, those who have qualified for unemployment or have experienced a reduction in household income, incurring significant cost or experience a financial hardship due to COVID-19, demonstrates a risk of experiencing homelessness or housing instability. Priorities will have those families with income up to 50% of AMI. The new program is featured with an online portal. Applicants can fill out on mobile device or computer, includes both tenant and landlord participation, and applicants can track progress and submission status. We have a call center, and it is the 1844 UNICT. If somebody needs help in completing the application is very easy. It takes 30 minutes. If you have a smartphone, you take a picture, and it will upload automatically. You can find the link to DOH UNICT. Very easy to access the portal. So again, the number is 1844 UNICT or 1844-864-8328. And I'm going to leave it at that if anybody has any questions.
Sayla's sticking around for questions. It's worth noting that in this current tranche, we have capacity to work with 25,000 or so, either tenants or landlords, both of whom are eligible, to apply, one and the same. And we are going to be getting a second federal grant as part of the most recent tranche over the course of the next month or so. And that's 25,000. We've probably had 1,200 applications to date. So there's plenty of capacity, no need to rush, and Sayla and her team are ramping it up. But we'll also have a deal with United Way so we can get, mobile vans and in-person help as well. With that, Josh and Paul are here to help as well. Any questions?
Channel 3 Eyewitness News.
Yes, Governor, so it seems like we're going to have enough vaccine, but will our scheduling infrastructure be able to handle this demand? Because we're currently seeing, like in this tier, there's still people struggling to get their appointments. So are there going to be any updates to the system between now and then?
Well, as you know, for the 55 and above, because we knew there was a lot of demand in that group, we greatly increased the number of people able to answer the phone. We increased the bandwidth for our website, and we've done extraordinary outreach. I was in Bridgeport, I was in Stamford, going out to underserved communities, telephoning out, doing everything we can, bringing them there, filling out the forms for them. So if we need to do even more, we'll do what it takes. But I do say, look, that first couple of days is always a crowd, and it takes a little bit of patience, and let those most in need get in the front of the line.
Exactly. And, now that any adult will be able to schedule an appointment on April 5th, hopefully, what should the expectation be, though, for the date that we're going to actually be able to get vaccinated?
The expectation is on April 5th, you'll be able to make those appointments. Did I miss your question?
Yeah, so we can schedule on April 5th, but what's the expectation for the actual date of the dose, for the date of the appointment?
Oh, you'll be making appointments for that forthcoming week and then a couple of weeks thereafter. We'll see what the demand is. Our estimation is those younger age groups, the demand won't be quite as pent up as it was for folks my age, and that's one of the reasons we're expanding the aperture a little bit. And we are going to have 50% more doses as well, so we'll be able to satisfy a lot more first doses.
And my final one now, just any thoughts of a 24-hour vaccination clinic like we're seeing in New York, Yankee Stadium?
I think my sense is if we have the supply and the demand is there, we're going to do everything we can to get it out the door. Speed really matters here. Look at the difference between Italy and Israel, for example. So if it takes a 24-hour, we would do that. Right now, we're finding during the business hours we've got, we're able to do a pretty good job of matching supply and demand.
Thank you.
News 8.
So, Governor, by shifting the age groups around, what are the amount of people in each of the groups, like 16 to 45, 45 to 55, 55 to 65, including educators, so people have an idea of how many people are going to be going after the vaccine at one time?
Josh, that's too tough for me. You want to take it?
Sure. So in this next group, the 45 to 54-year-old age group, there's about 477,000 people in Connecticut of that age. However, we know that not everyone will rush out to get vaccinated. We've used a planning assumption, as we have throughout, of about 60%. So that's about 268,000 people we'd expect to be charging into this next phase. But it's also important to note about 85,000 of those people have already been vaccinated because they work in healthcare, they're phase 1A population, or perhaps are in the educator clinics that have been going really well. So we think there's about 200,000 people that are going to be in that age group looking to get vaccinated in the 2 weeks that we open who aren't already vaccinated. So that's about, a week and a half to 2 weeks of supply at this point.
And then for the younger age group, you have 16 to 45. And
Sure.
I'm sorry to get into the details, but yeah.
No, that's okay. It's important. So from the 16 to 35, we've got about 1.3 million people in the state of that age. As the governor mentioned, we do expect, the uptake there may be a little bit lower, but still sticking with that 60% planning assumption, that's about 785,000 people. And again, we've had, about 160,000 people in those age groups already vaccinated. So that's maybe 625,000 to go, which, as the governor said, with, perhaps 200,000 doses a week in the month of April coming in, that gives us confidence that, by the time we get to the end of April, early May, most everyone in Connecticut who's eager to get access and get vaccinated should have that opportunity. And then the game will change to continuing to work to drive those rates up across the board in all of our communities.
And then just one last question for the governor. Does it seem like with the youth less likely to take the vaccine, how would you feel about colleges requiring it to get back into the dorms or schools to get back into the classroom? Should there be requirements there for the younger age groups?
Well, we've been talking to some of the colleges. They are thinking about providing the vaccine to everybody before they go home, either spring vacation or summer vacation, just so, and hopefully other colleges are doing the same thing, which would manage that. For schools, look, our strong recommendation is all the educators are going to be vaccinated. Right now for the kids, none of the vaccines are approved for anybody 16 and under, so I think that's going to take a little bit longer.
NBC Connecticut.
And good afternoon, Governor Matt Austin with NBC Connecticut. I know during previous waves you had raised some concerns about kind of opening the floodgates because of some of the strong demand we had seen in other states and some of the challenges that they had run into. I guess how confident are you that we're not going to experience that with these upcoming dates and eligibility increases?
Well, look, I'm never super confident, but remember 6 weeks ago we had, less than 50,000 doses, so we'll be up at 200,000 doses a week very soon. And we know exactly the cohorts, how big they are, and I think we do have a lot more capacity. One estimation is there might be a little less urgency for the youngest folks, like I said, so that could tilt the balance a bit, but I think it's going to work out pretty well.
Yeah, I think it's worth pointing out that a lot of the issues we've seen in other states don't necessarily have to do with how many people become eligible all at once. It has to do with the very complicated and confusing eligibility criteria that have been rolled out that result in even more people than you anticipate charging into the line all at once, again, chasing that limited vaccine supply, which then crowds out, the people who are most at risk. That's why governors pursued this age-based strategy, which has helped ensure that, our most vulnerable elderly people have had a clean run at vaccine appointments for the last 2 months.
And just in terms of the vaccine sites that we have right now, can they handle the increased doses that the state is looking at, or are there plans to further increase vaccine sites, including, mass vaccination clinics?
Keep going, Josh.
Yeah, our vaccine providers are ready to do far more. For weeks, they've been begging us for more vaccine. I commonly hear from people who go get vaccinated at some of these large mass vaccination sites. They say, it looks like they can be doing a lot more than they're doing. They've got a lot of extra chairs. And the answer is yes, they do. They're ready to go. And we have a very high degree of confidence that they'll be able to scale up as quickly as the supply comes from the federal government.
Okay, thank you.
Fox 61.
Hang on.
Fox 61.
Hi, Governor. What's your message to those individuals that fall between the 35 to 44 age group that are a little upset about this switch, feel like they've been cheated out of their specific chance with, let's say, less competition to make their vaccine appointment?
I haven't heard that, especially since we only announced it about 8 minutes ago. But I think people are going to understand that this is done based upon some good reasoning, that we got a lot more vaccine than we'd even anticipated 3 weeks ago. I think people know we've been able to manage the flow pretty successfully for the last 2 months. I think people will be good.
I'd also just point out, up until this point, what we told those folks was that they were going to become eligible on April 12th, and the next phase would start in early May. And what we're telling them now is they're eligible a week earlier, and they're still going to get their vaccine before the end of April.
And then are there any increased concerns about people from out of attempting to come to Connecticut to get a vaccine with this opening on April 5th?
No, you got to show, license or ID that shows you live here in Connecticut. I think people are playing games in other states, a lot less likely to play games here.
News 12 Connecticut.
Governor, this is Suzanne Goldklang. Could you talk a bit more about the prioritization of needs with DDS and how you will see yourself, making sure that the people within each age bracket that have the most serious comorbidities do get some prioritization with the big groups coming online?
Yeah, I'll start. I mean, the first thing is just my urging, rather than sitting around trying to determine whose comorbidity is more severe than others. Use your judgment. Make room for those who probably are a little bit more at risk. And Josh can further explain how we're working closely with our hospitals now that we've taken out the age metric. They are able to go out and find folks, their patients who are most at risk, invite them in for the vaccine.
That's right. And Commissioner Gifford is in discussions with the chief medical officers at our major healthcare providers. Is once we get to that general availability point, they obviously know, who are, the most severely ill and at risk younger people. And they'll use those first couple of weeks to make sure those folks have the opportunity to get in quickly in early April to get vaccine. And then we're going to be working with Commissioner Jordan Sheff from Department of Developmental Services to look at opportunities for some dedicated clinics for individuals with intellectual and developmental disabilities, providing them with a comfortable environment to get vaccine, recognizing that the needs are a little different there. So those are things we're going to be working on over the next 3 weeks as we approach that next phase, and we'll have more details to share on that as we get closer.
Now that we have at least some high school students eligible, how do you see that impacting precautions at school, perhaps spring sports, other events like graduations where potentially, the graduates may be vaccinated? If you can talk a little bit about the impact now that we have teachers and some students.
This is in part what we had anticipated when we said spring sports will be open, and we do anticipate graduations. As you know, high school was a little bit riskier, we thought, just because it was tougher for kids to cohort. So I certainly hope when it's their opportunity, that age group, 16 and above, do get vaccinated.
Thank you.
WTIC 1080 News.
Hi, everyone. On the issue of underserved communities, there's a big volunteer effort in Fairhaven to knock on every door and sign up everyone who's willing to get vaccinated. Is that maybe a further way to close the gap in other economically stressed neighborhoods?
Yeah, no, that's absolutely right. I mean, we are working hard with our not-for-profit partners. You saw what they did in Fairhaven. They knocked on thousands of doors, getting people signed up. I was at a church in Bridgeport. We were at a not-for-profit in Stamford this weekend for the Hispanic community, telephoning out, doing everything we can to make sure they know we have the vaccines available. We can make you an appointment. We can fill it out. Come in. No questions asked.
And as of Friday, 175 cases of the UK variant, which is more transmissible, and one study showed last week it's more deadly. Are you concerned about that, and what's the latest with the numbers there?
We were on the phone with Pfizer again this afternoon. I mean, the good news is all the vaccines are working pretty well against these variants. And Pfizer, if something changes, if they become less effective, they do have the ability to come out with a booster shot. They can do it in about 30 days' notice, subject to the emergency approvals. So I think we can stay ahead of this.
Is there an indication that that rate's going to go up because of the transmissibility?
What I do know is it didn't really go up dramatically in some of the places it's been for a while. I noted that New York City, which has their own sort of unique variant, which is not dissimilar to what you see in South Africa, they've ticked up a little bit, so we are watching that. But I think nationwide you haven't seen a big ramp up, no.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, just to follow up on that question about the variants, is there any signs that the New York variant has been found in Connecticut? And also, how are we monitoring for it? Dr. Fauci over the weekend had voiced some concern about that variant in particular.
Josh, you know how we're testing on that?
Yeah, well, it's a good question, and we're working with our partners at Yale, at Jackson Labs, and our state lab to look at opportunities to do more sequencing and screening for these variants. So that's something we're continuing to look at and potentially scaling up in the future.
So we are doing that already for all of the variants, or are we doing anything particular for this New York one?
Yes, they're screening for all of the major identified variants.
And I understand the CDC is revisiting guidance that had called for 6-foot social distancing in schools. There's discussion that maybe 3 feet may be enough. Is this something that Connecticut is looking at? Would it change how Connecticut schools might operate?
Yeah, that's a great question, Sue. You're right. There have been a number of studies that have shown, 3 foot of distancing with the mask is appropriate in places where you don't have very high positivity rates. CDC hasn't formally opined on that, but they've told us, to the governor's group, that if you don't have a high positivity rate, that 3 feet is probably pretty good. And I use it as just a message to, parents and teachers and students. I mean, especially in our urban schools, sometimes while the school is open 5 days a week, maybe only half the kids feel comfortable coming in. And that obviously provided a lot of additional spacing over the last 6 months. But that's not the way to do it. I'd like to see those kids feel confident to come in. We get more and more people vaccinated. I think it's you can finish off the school year with your friends.
And just one quick question. The 31% adults that have received the first dose, does that percentage, does that include people that have received the Johnson & Johnson 1-dose vaccine?
I believe it does.
Yes.
Okay, great. Thanks a lot, everyone.
Thanks, Sue.
Connecticut Public Media.
Good afternoon. What would you say to the people that, a few weeks ago when it got changed to an age-based rollout, were frustrated that underlying conditions weren't being considered first? Now you're saying they are going to be considered for the younger age group. What changed to make it easier to determine who has an underlying condition?
Well, for me, what changed is people over the age of 55, where most of those pre-existing conditions were, and much more likely to have complications and much more likely to die. We showed you the chart where even 45 and above, there's still a 14 times differential compared to the youngest. But at some point, you get to a younger demographic. We thought it was appropriate to open up, but we really led with public health, and I think it's paying off.
Yeah, and we had also, we had always anticipated doing this when you get to the point of general availability, because at that point, you don't need a doctor's note, you don't need to draw bright lines between certain conditions, because at that point, everybody's eligible. So we can really now leave it to our healthcare professionals to use their judgment and bring people forward in early April as they see fit.
And I guess realistically, if someone does schedule their vaccine or try to on April 5th, when would be the latest they would get it? What's an estimate of how long it might actually take them to get an appointment?
Yeah, as we mentioned earlier, again, it'll depend on a lot of variables between now and then, the increasing rate of supply and the uptake among these different age groups. But our best estimate right now is that by the end of April or early May, we'll start to see the supply start to catch up with demand.
Okay, and a follow-up to the first question, are you going to hold appointment slots open for people with chronic illnesses in that age group? Or is it just going to be the doctor suggests you get it, they have the vaccine, they can give it to you?
Yeah, we're really going to leave that with our healthcare providers, our hospitals and community health centers. They are all getting significant allocations of vaccine already. We'll look to make sure they have adequate, and then they can run whatever process is most aligned with their patient population and their vaccine administration sites.
Thank you.
CT News Junkie.
Thanks, Max. Do we know right now, if I was 55 or older, how late we're scheduling out vaccine appointments for people that cohort right now?
Yeah, I think there's still some folks that have some dates out there a couple of weeks into the future. But as the governor pointed out, there will be even more appointments coming online as we go through this week. And I think that by the time we get to Friday and open up to the next level of eligibility, we'll be above 50% of that 55 to 64 group will have actually been vaccinated. And then another 10% at least will have appointments scheduled in the next week. So, we'll be well covered there as we move to the next phase.
Okay. Governor, the legislature is considering, they're having hearings today on some tax proposals. I know you generally haven't been supportive of that in the past. What's your standpoint now that they're kind of moving in that direction?
I'm still not supportive. I mean, we just got $10 billion from the federal government. Some of it are direct payments that'll be a shot in the arm for our economy. And about half of it we have discretion over, which will be helpful for education, helpful for rent relief. That will be extraordinarily helpful for our not-for-profits. So I'm going to be working closely with the legislature as we figure out what our priorities are for that money. I think we're in pretty good shape right now.
Okay. I had one more reader question. Reader was wondering if the state would look into applying for a waiver for federally mandated standardized testing for kids. Is that something we would do?
I'd certainly look at it. I mean, you probably want a different type of a test, I would think, just because we've had, 150,000 kids plus who haven't been in the classroom for 8 or 9 months. So, it's interesting to see how they are on verbal and math skills. I'd like to have a little broader sense of how they're doing. So I think it's something we should consider.
You mean keeping the tests or delaying the tests?
Or maybe a waiver in terms of the type of test we do. We have to have an update on how these kids are doing.
Okay. All right. Thank you.
The Day of New London.
Hello, Governor. Regarding the status of the gaming agreement and the talks with the Massachusetts tribe, it's my understanding that the sticking point that they identified, the tax on the online gaming revenue, that's been resolved. So I'm wondering what's holding it up now. Have more issues that were thought to be resolved? Are they back on the table? And just how close are we? Are we still the proverbial 1-inch line?
I think we're on the 1/10 of 1-inch line, but I don't want to jump the gun. Paul?
Football references. So, correct. One of the bigger issues that was over the past few weeks was dealing with the tax rate on iGaming. There is a firm agreement with all parties on that. There was another issue that was later put on the table by the Mashantucket Pequot Tribal Nation. And we are hopeful as we go through those conversations that is now between the two tribal nations that we will have some progressive and very positive news in the coming days, as soon as tomorrow. So we'll wait and see, but I just first and foremost want to say on behalf of the governor, with the great job of our negotiating team, Commissioner Lehman, Secretary McCall, and we'll look forward to any developing news from the tribal nations at this point.
The resolution of the tax matter, can you say in whose favor was that resolved?
Well, any negotiation, all parties got to come to a conclusion on it. I wouldn't say that it was one side or another who's win. At the end of the day, a global agreement on gaming is a win for the Connecticut taxpayer as the role that we had to play in terms of the negotiation. But overall, there's always a lot of give and take that has to do with a negotiation of this magnitude. But we look forward to be able to unveil the full plan in the coming days.
Thank you.
The Waterbury Republican American.
Thanks very much. I was just wondering, I did some quick back of the envelope math. So we're doing about, what, 35,370 shots a week, averaging based on the numbers that you reported today. What are we doing right now?
A lot more than that. Josh?
We did over 200,000 shots last week.
Okay, but on like 200,000 shots on last week. So how does that? Well, okay, all right. We talked about those numbers. In terms of the reopening, Governor, on Friday, in the fall, you gave towns and cities an option to roll back reopening rules if over a 2-week period, I believe, if they had their rate was 15 cases per 100,000 or something along that line. Are you contemplating offering that kind of option again as we get ready to relax some reopening rules this Friday?
Yeah, Paul, certainly nobody has asked us about that. We're a relatively small state, so we like to do things together, and our infection rate is pretty consistent across 169 towns, so I don't anticipate that. I think we'll be at 100%, but I also know that we're going to be wearing the masks and having distancing in those restaurants and beyond.
Okay, and I see, you know, the American Job Centers have sort of opened up by appointment only now. What's the plan for other state offices and agencies as we progress through this vaccination program and sort of vaccination rates and herd immunity builds up?
Yeah, that's a good question. Look, we're planning to get those reopened. I think we have a low infection rate across the state. We have a fair number of folks that don't like to do everything online or even phone. They need to come in. So whether it's a jobs search or even rent relief and the such, we're going to have in-person opportunities for people.
And I just like to follow up on Sue's question because, you know, I always, all things Johnson & Johnson, I guess. Do we have a breakdown of how many Pfizer, Moderna, and Johnson & Johnson vaccines have been administered?
I see 35,000 J&J doses, and I think most of the rest, probably 60-40 or Pfizer versus Moderna. But Josh, you may have something better.
Yeah, we've done 35,000 J&J, as the governor said, 1.3 million Pfizer and Moderna. I can get you the split of that if you'd like, Paul.
Okay, and just what is the expectation for when, I guess, everybody who wanted to get vaccinated the first time through will get done? If we open up in April 5th to everybody, what are we looking at? June, July, August?
I think you're going to find, by mid-May, we're going to be going out trying to convince people that they ought to come in and get vaccinated. You're going to get to that group of people, 25, 30%, that are a little reluctant, don't feel the urgency, and we're going to be trying to bring them in.
Okay, thank you very much.
CT Examiner.
Hey, Governor, what is it about Connecticut that's allowed us to move up our timeline so dramatically? Is this mainly about federal supply? And if that's the case, do you expect our neighboring states to be moving up their timelines similarly? Or are there other factors about Connecticut that have allowed this to happen?
Well, I think we've got a pretty good distribution system. It's like a Swiss watch. It's working pretty well. As Josh said, we got the capacity to do twice as much, 3 times as much, 4 times as much vaccine. We are getting a lot more right now. And I think those are the 2 main reasons that we feel very confident that we'll be able to handle this accelerated timeline. And I know what it means to people.
Thank you.
The Hartford Current.
Hi, Governor. This is Eliza Fawcett from The Current. So if you're leaving prioritization for high-risk residents up to healthcare professionals now, how will the state ensure that those residents will get prioritized and that their vaccinations will be accelerated?
Josh, why don't you start with that?
Yeah, and to be clear, we're talking about the matter of a couple of weeks here. You know, when we get to that last phase, April 5th, as we've mentioned, we think by the end of April, early May, everybody in that group will have access to a vaccine. So we're really talking about just the first couple of weeks of April. And like I said, Commissioner Gifford, the chief medical officers from the healthcare providers are going to be discussing, you know, certain conditions and how they want to approach that. And we'll have more information on that in the next 3 weeks before we get to that point.
Do you expect them to follow the CDC guidelines, or will there be another prioritization system put in place, do you think?
No, we don't, because as we previously discussed, the CDC was not particularly helpful based on the list they provided, represented 2/3 or more of the entire adult population. So I think that it would probably be more focused on, you know, the most severe and most high risk individuals in those groups.
And you had mentioned 200,000 doses coming in soon. Is that largely J&J or Moderna or Pfizer? Are those first doses and second doses? What's the breakdown there?
It's just first doses, and it will be a mix. I think the big change, as the governor mentioned earlier, as this ramps up as we get to the end of March and into early April, is that Johnson & Johnson, we had a large shipment the first week of March, but it's really gotten quite low over the last several weeks. The federal government has indicated that should really pick up at the end of March and into April, so that mix will improve with a lot more J&J coming in.
Thank you so much.
The Connecticut Mirror.
Thanks, Max. Governor, I wanted to go back for a minute to the latest round of federal pandemic relief and the issue of taxes, but not tax increases, tax cuts. One of the last-minute changes the U.S. Senate made was to include language that said that states, for the most part, can't use the money to fund a tax cut. I know everything in the budget is somewhat fungible, but do you think, because there are some proposals to provide tax relief to different groups, if this new federal language and the presence of the federal money in the next state budget is going to complicate efforts legally for anyone who wants to give anyone a tax cut?
Yeah, Keith, I think that's a really good question. And we are waiting for guidance. I mean, are they talking about just broad-based, like income and sales, because they don't want everybody to use the federal money just to cut taxes? They want to provide extra support for people coming out of COVID. I've heard from some governors saying, hey, we were planning a tax cut. In fact, our revenues are already coming back. You mean we can't do it? So I think there will be some guidance on that. But I understand the intent that they had, which was we want these money to go to services and education and kids who are left behind. I don't want it just to pay for a tax cut in the near term.
Thank you.
Hearst, Connecticut Media.
Good afternoon. When your office announced these new dates, they said April 5th is a tentative date. How tentative is April 5th for the rollout for 16 to 44?
Unless the world shifts on its axis, I'm feeling pretty good about April 5th. You can book it.
I guess my follow-up to that is why April 5th? I know the president last week said May 1st for all states. It's a pretty substantial jump from May 3rd to April 5th.
Again, Nick, we just we calibrated the vaccines. We got the 3-week window. So far, they've been very accurate as they anticipate, telling us what we're going to get in terms of those vaccines. We looked at the cohort of people. We were reminded that about 20% of them have already been vaccinated because they are healthcare or education, workers. So we felt like this was a change that we could make and do it efficiently. All right, I'm getting the signal here. Just a reminder, it's been one heck of a year. For a lot of us, we aged probably 5 years, but not Max Reese and Rob Blanchard, our amazing communications team who've been putting together this show for a year. And today, they are both a year older. They share the same birthday. They're twins, just like Arnold Schwarzenegger and Danny DeVito, twins. We thank them for all their good work. Take care, everybody.